Laboratory in Kent, England, 1989, a team of scientists thought they were on the verge of curing heart disease. Instead, they stumbled upon something that would change human intimacy forever, spark a billion-dollar industry, and accidentally unleash one of the most consequential pharmaceutical discoveries in modern history. This is the story of a failed experiment that became a global phenomenon, a beautiful mistake that reshaped sexuality, saved relationships, threatened lives, and raised questions we're still trying to answer today. This is the story of the little blue pill that was never meant to exist. The compound was called UK92480, and on paper it looked perfect. Chemists at Pfizer's research facility had designed it to dilate blood vessels, reduce blood pressure, and ease the crushing chest pain of angina by improving blood flow to the heart. Clinical trials began with cautious optimism. Patients were monitored carefully, their vitals tracked, their symptoms documented. But something unexpected was happening, something the researchers hadn't anticipated and initially tried to ignore. Male participants were reporting an unusual side effect, one they were often too embarrassed to mention during formal check-ins. When nurses collected unused pills at the end of the trial, men were reluctant to return them. Some asked if they could keep taking the medication even though their heart symptoms hadn't improved. The scientists were baffled until they started paying attention to what wasn't being said in the medical reports but was being whispered in private conversations. Dr. Ian Osterloh, the lead researcher on the project, faced a professional crisis. By every measurable standard, UK92480 was failing. It didn't significantly reduce blood pressure, it barely touched angina symptoms. The trial should have been terminated, the compound shelved alongside thousands of other failed experiments in Pfizer's archives. But Osterloh noticed something in the data that didn't add up. He noticed the reluctance, the whispered reports, the pattern emerging from men across different age groups. When he finally confronted the truth behind the side effect, he realized they hadn't failed at all. They had succeeded at something entirely different, something medicine had struggled with for millennia. Erectile dysfunction had plagued men throughout human history, shrouded in shame, treated with bizarre remedies ranging from ground rhinoceros horn to electric shock therapy. By the late 20th century, the only reliable treatments were invasive, uncomfortable, and psychologically devastating. Penile implants required surgery. Injection therapies meant stabbing yourself before intimacy. Vacuum pumps were mechanical and awkward. The medical establishment had largely given up on finding a simple, dignified solution. Then came this accidental discovery, this failed heart medication that worked through a mechanism nobody had fully understood. The science was elegant in its simplicity. During sexual arousal, nerve signals trigger the release of nitric oxide in the erectile tissue of the penis. This nitric oxide activates an enzyme that produces cyclic guanosine monophosphate, or CGMP, which relaxes smooth muscle cells and allows blood to flow into the spongy chambers of the penis, creating an erection. Another enzyme, phosphodiesterase type 5, breaks down CGMP, ending the erection. UK92480, it turned out, blocked this breakdown enzyme. It didn't create arousal, didn't manufacture desire, but when desire was present, it allowed the natural biological process to proceed unimpeded. It was brilliantly simple, and it was entirely accidental. To understand why this mistake mattered so profoundly, we need to journey back millions of years to the evolutionary origins of human sexuality itself. Our prehistoric ancestors faced a reproductive challenge unique among primates. Unlike most mammals, human females evolved concealed ovulation, hiding external signs of fertility. This created evolutionary pressure for more frequent sexual activity, for pair bonding, for intimacy that served social purposes beyond mere reproduction. Sex became communication, became currency, became the glue holding human relationships together through the grinding challenges of survival. But evolution is an imperfect architect. the same cardiovascular system that keeps us alive, that pumps blood through 60,000 miles of vessels, becomes vulnerable to age, stress, disease, and deterioration. The delicate hydraulic mechanism of male erection depends on healthy blood vessels, proper nerve function, and a cascade of chemical signals that can be disrupted by diabetes, heart disease, psychological stress, or simply the passage of time. By age 40, approximately 40% of men experience some degree of erectile difficulty. By 70, the number approaches 70%. Evolution optimized us for reproductive success in our 20s and 30s, then largely abandoned us to the consequences of aging. For thousands of years, humans tried to fight back against this evolutionary limitation. Ancient Egyptians prescribed a mixture of ground baby crocodile hearts and wood oil. Chinese medicine turned to ginseng and exotic animal parts. Medieval Europeans believed mandrake root held the answer. The desperation was universal, transcending culture and time because the stakes were so high. In a species where sexual function intertwined with identity, relationships, and psychological well-being, losing that function felt like losing part of what made us human. Pfizer faced a decision. They could file away this curious finding, or they could pivot entirely, redirecting millions of dollars towards a market that didn't officially exist yet. In 1991, they made the bet. The compound was renamed sildenafil citrate. Clinical trials were redesigned, this time focusing on erectile function rather than cardiac symptoms. The results were staggering. Men who hadn't achieved an erection in years suddenly could. Relationships that had withered revived. The psychological transformations were as dramatic as the physical ones. On March 27, 1998, the FDA approved sildenafil citrate under the brand name Viagra, and the world changed overnight. Within the first week, 30,000 prescriptions were written. Within 3 months, it became the fastest-selling drug in pharmaceutical history. Pfizer's stock soared. Comedians made it a punchline. Doctors fielded desperate calls from patients they'd never met. The little diamond-shaped blue pill became a cultural icon before most people understood what it actually did. The name itself was a stroke of marketing genius, combining vigor and Niagara, evoking strength and powerful natural force. The dosage was calibrated carefully, typically 50 milligrams for most men, though it ranged from 25 to 100 milligrams depending on response and tolerance. The pill was designed to be taken approximately 1 hour before sexual activity, its effects lasting 4 to 6 hours. It wasn't an aphrodisiac, wasn't a love potion, but in a culture that conflated sexual performance with masculine identity, it might as well have been magic. Sales exploded past $1 billion in the first year. By 2008, Viagra had generated over $1 billion annually for a decade straight, treating millions of men worldwide. Competitors rushed to develop similar drugs, tadalafil, vardenafil, and avanafil, each with slightly different chemical profiles and duration of action, but none captured the cultural imagination like the original Beautiful Mistake. But beautiful mistakes carry hidden dangers, and the story of Viagra has a shadow side that emerged as recreational use spread beyond medical necessity. The drug was designed for men with genuine erectile dysfunction, tested on populations with cardiovascular disease, diabetes, and age-related decline. As it became a lifestyle drug, a performance enhancer for healthy men seeking superhuman stamina, the complications began to reveal themselves. The cardiovascular effects that made Viagra a failed heart medication became life-threatening when combined with other drugs. Nitrate medications, commonly prescribed for chest pain, create a catastrophic drug interaction with Viagra. Both dilate blood vessels, and together they can cause blood pressure to plummet to deadly levels. Within the first year of release, over 100 deaths were reported in men taking Viagra, most involving cardiovascular events in patients who shouldn't have been taking it at all. The FDA investigated. Warnings were strengthened. But the deaths continued, a steady trickle of men who gambled with chemistry they didn't understand. The physiological process of overdose is brutal and terrifying. Excessive doses of Viagra amplify all its effects. Blood pressure drops precipitously. The heart, struggling to compensate, races dangerously fast. In extreme cases, men experience priapism, an erection lasting more than 4 hours that becomes a medical emergency. Blood trapped in the penis begins to clot, starving tissue of oxygen. Without immediate treatment, permanent damage occurs, destroying the very function the drug was meant to restore. Emergency rooms see these cases regularly, young men too embarrassed to seek help until it's almost too late, their genitals swollen and discolored, tissue dying from oxygen deprivation. The heart itself suffers under the burden of overdose. Sildenafil affects not just the penile vasculature.
Sildenafil affects not just the penile vasculature, but blood vessels throughout the body. For men with underlying heart conditions, even normal doses can precipitate heart attacks or strokes. The drug increases cardiac output, raises the heart's oxygen demand, and in arteries already narrowed by atherosclerosis, this can be the final stress that triggers complete blockage. Autopsies of men who died during sexual activity while on Viagra show ruptured plaques, massive clots, hearts that simply stopped when pushed beyond their limits. Beyond the immediate physical dangers, researchers began noticing psychological dependence. Healthy young men, convinced they needed Viagra to perform, found themselves unable to achieve erections without it. The pill became a crutch, then a necessity, creating exactly the dysfunction it was meant to treat. The brain, that ultimate sexual organ, learned to associate arousal with a blue pill, and without it, confidence evaporated, taking natural function along with it. As millions of doses circulated globally, researchers gained unprecedented insight into human sexual physiology. Studies emerged showing Viagra's effectiveness varied dramatically by underlying cause. Men with purely psychological erectile dysfunction responded differently than those with vascular disease. Diabetic men needed higher doses. The drug worked less well in men with severe nerve damage from spinal injuries or pelvic surgery. Unexpected benefits surfaced in other areas of medicine. Viagra showed promise treating pulmonary hypertension, high blood pressure in the lungs, by dilating pulmonary arteries using the same mechanisms with dilated penile vessels. It was rebranded as Revatio for this purpose, the same drug with a different name, treating a completely different condition. Researchers explored potential benefits for altitude sickness, Raynaud's phenomenon, even female sexual dysfunction, though results in women proved far more complicated and controversial. Questions remained unanswered. Why did approximately 30% of men not respond to Viagra at all? The non-responders haunted researchers, suggesting gaps in understanding of erectile physiology. Some theories pointed to psychological factors overriding chemical intervention. Others suggested genetic variations in the phosphodiesterase enzymes or differences in nitric oxide production. The truth was that even 25 years after its discovery, science hadn't fully mapped the intricate interplay of psychology, neurology, vascular health, and hormones that govern sexual function. Long-term studies began revealing patterns that troubled researchers. Men who started taking Viagra in their 40s and 50s were still taking it in their 70s and 80s, but efficacy seemed to decline over years of use. Were bodies developing tolerance? Was underlying vascular disease progressing? Or were expectations simply escalating beyond what chemistry could deliver? The data remained murky, complicated by the fact that aging itself changed the sexual landscape in ways difficult to separate from drug effects. More concerning were hints of potential long-term risks. Some studies suggested associations between PDE5 inhibitors and increased risk of melanoma, though the mechanism remained unclear, and other studies found no connection. Reports of sudden hearing loss and vision changes, including rare cases of permanent blindness from non-arteritic anterior ischemic optic neuropathy, led to additional warnings. The safety profile was generally favorable for most men, but the beautiful mistake carried risks that became apparent only across millions of users and decades of time. The impact of this accidental discovery rippled far beyond medicine. It sparked conversations about aging, masculinity, sexuality in older adults, and the medicalization of human experience. It challenged the notion that sex belonged only to the young. It created billion-dollar industries in counterfeit drugs as criminals rushed to exploit desperate men unwilling to see doctors. It changed the economics of pharmaceutical research, proving that lifestyle drugs could be more profitable than life-saving medications. Scientists now understood that many discoveries in medicine came from exactly this kind of beautiful mistake, from observing unexpected effects and having the wisdom to recognize their significance. Penicillin was a contaminated petri dish. The pacemaker emerged from failed experiments timing heart sounds. X-rays were discovered while studying cathode rays. Viagra joined this pantheon of accidents that changed the world, reminding us that progress often comes from directions we never anticipated. The story raises profound questions about what we're willing to risk for desire, for connection, for the maintenance of identity in the face of aging. Men have died taking Viagra, chasing a version of themselves that time had eroded. Others have had relationships restored, confidence rebuilt, years of intimacy salvaged from the wreckage of disease or age. The beautiful mistake gives and takes in equal measure, offering second chances while extracting a price not everyone can afford to pay. Today, Viagra exists in a strange liminal space between medicine and lifestyle choice, between treatment and enhancement, between beautiful mistake and calculated design. Generic versions have made it accessible to millions more. Younger men take it recreationally, chasing performance standards set by pornography and cultural anxiety. Older men depend on it for relationships that might otherwise have ended. The scientists who discovered it accidentally while trying to fix hearts could never have imagined the world they would create. Perhaps the deepest mystery isn't how Viagra works, but what it reveals about us. What does it mean that a failed experiment became one of the most successful drugs in history? What does it say about human priorities, human anxieties, human willingness to gamble with biology for the sake of desire? The beautiful mistake holds a mirror to our species, reflecting our desperation to defy evolution's timeline, to remain sexual beings long after our reproductive prime has passed. Somewhere in a laboratory, another accidental discovery is waiting to happen, another beautiful mistake that will reshape lives in ways nobody can predict. The scientists won't be looking for it. They'll be searching for something else entirely, just as the Pfizer team was seeking a heart medication when they found Viagra. And when it happens, when the unexpected side effect emerges and someone has the wisdom to notice, the world will change again in ways we cannot imagine. The little blue pill sits in medicine cabinets across the world, a monument to the power of paying attention, of recognizing significance in failure, of understanding that the most profound discoveries often come from the places we least expect. It reminds us that science advances not just through careful planning, but through beautiful mistakes, through accidents observed by minds prepared to see what others might miss. And in that reminder lies both hope and warning. that our attempts to control nature will continue to surprise us, that our mistakes may be more valuable than our successes, and the consequences of those mistakes, beautiful as they may be, will haunt us in ways we're only beginning to understand.